This is Dr. Katsanis from the Wellness Metabolic Institute in Grapevine, Texas. This is February the 12th. Here I have one of my patients that came to see us, and Dr. Kachatrin and myself have been working with this patient for 3 weeks, and we like her to participate in the interview, of course. I'm going to ask you some questions. Please introduce yourself.
My name is Mary. I'm 48 years old.
When was the first time you got sick, to the best of your recollection?
When I was 27.
What happened at that age?
I developed severe chronic fatigue, chronic pain, and depression.
What did you do about this?
In the past 20 years, I've probably been to over 100 doctors in 2 cities. I've had more tests than you can possibly imagine.
Okay. Tell me your profession. Tell what's your profession?
I'm a licensed occupational therapist.
How long did you work for? How many years?
I worked from 1984, off and on, full-time, part-time, with a lot of pain and misery until about 3 years ago. I have not been able to work at all for 3 to 4 years.
And that's because of the pain or because of being tired all the time?
I continue to have chronic fatigue. I continue to have chronic pain. But I got much worse. I began having many neurological symptoms, including severe vertigo, balance problems. I limped on my left leg, numbness, severe burning pain. The list of symptoms is about 3 pages long. Blurry vision.
Yeah, I understand that your other doctors diagnosed you with many infections. Is that correct? Lots of infections.
Yes, I've tested positive for many different infections: parasitic, bacterial, viral.
Okay, good. And now you've been coming to this clinic for 3 weeks.
28 days.
28 days. Can you tell us a little bit about your positive and your negative experience with the program?
I think this is a very positive program. It's given me hope that I have not had in years. When I came in, I was taking a page full of prescriptions and supplements, and they asked me to try to go off of them, and I was fearful. I went off of most all of them immediately, and several I gradually weaned over the few weeks, particularly antidepressants that help me sleep. I was successful in going off the medications. The biggest change is that I have energy. I don't have to lay in the bed in writhing pain or with severe fatigue on and off all day long. But the biggest change for sure is that I have energy.
How many hours a day do you sleep right now?
Currently,
Mm-hmm.
Currently I sleep about 5 to 7. My body's not fully adjusted to not being on the medicine, but I have begun to sleep more, and my energy has picked back up since stopping the medicine.
What percent of energy, let's say, if the time you started the program was whatever, 10-20% of normal, what's your energy today? What percent would you say towards normal?
I would say I'm probably 75% towards normal with energy, and when I came in, I would say I was probably 20%.
Okay, good. How's your pain?
I still have burning pain, but I'm no longer taking the Neurontin that I had to take prior. So it's a little better.
Okay. How much better without medicine?
It changes from day to day and from time to time. It's hard for me to answer.
Okay.
I hope that when I leave the program in a few days and I'm no longer taking, all the charged solutions and the IV and things, that my body is able to maintain the changes.
Okay. How's your mental status? I mean, remembering things, and is it better with the program?
It is better. I came in with a lot of brain fog, and as I did the program, that worsened shortly for a while. I also had numbness and things, and I struggled to drive before the program, and I struggled to drive during the program, but this week I'm not struggling to drive as much.
Okay, that's good. Okay, so would you say overall, is this one of the best programs you've been on, or have you seen something better than this, or this is the best program you've been on since you got sick?
In 22 years, this is by far the best program I've ever done. By far.
Okay. Well, thank you for your time, and we're looking forward to seeing you and maybe interview you again in the future. Thank you.